Mike Erlob here with Flex Physical Therapy, and what I'd like to talk to you about in this coaching program is I'd like to talk to you about self-treatment for posture. So poor posture is really one of the main issues that people will have related to their back pain. And in our society, we just sit way too much. And so every time that we're sitting, what's happening is we're getting more stress on this vertebrae because the curvature of the spine is actually, instead of being like that, it's actually flattening out. So our pelvis rolls back and it flattens out the spine, and that compresses the discs. The next thing that happens is when you're in that seated position is your psoas muscle, which is this hip flexor, will shorten. So the psoas muscle gets short, the discs get more pressure on it. Those two things combined could create big time problems for you. So every 30 minutes, you should be getting up from a seated position. And what I want you to do is this. A self-treatment for that is to actually stand up, take your hands, and I want you to clasp them overhead. You can either do this or you can put them like that, but I want you to go behind your neck, okay? Then what I want you to do is I want you to squeeze your shoulder blades together, and then you can move back, front, side to side. But what this does is this engages your upper back muscles, helps you pull into a better posture. Now, if you can't get your hands behind your head because maybe you have a shoulder issue, stand up and just cross them across the body so you can modify that. And then just bend side to side and front. But do that for a few seconds. And actually what's best to do is when you do this one is hold the contraction when you squeeze back for about 5 seconds and then relax, and then squeeze as you do the movements, okay? And do like maybe 5 to 10 repetitions, or if you're crossing the arms, just do 5 to 10 repetitions of the movements back and forth. That will greatly help you with your posture and alleviating some of those problems with your back.